Hello, I introduced myself earlier, but in case anyone wasn't here, I'm Dr. Vicky Joshi. I'm a research fellow at Glasgow Caledonian University, and I kind of look after the South Recovery group. Now, South Recovery wouldn't exist without all of the amazing work that you do, because we wouldn't have any survivors to be thinking about. So I think South Recovery, by the sounds of it, all these amazing projects and things that are coming, hopefully what we're going to have is more work to do in the future, because we're going to have more survivors. I'm just going to give you a little kind of update on some of the things we've been doing in the last year, and a little reminder about what we do in South Recovery and who we're interested in. So survivors, really obviously. If you've heard me talk before, I'm listening to Ron and he's talking about the 22-year-old that was discharged and everything's great, and I'm thinking, ooh, I wonder how his brain is. I wonder how he's feeling. I wonder what he's thinking about having an ICD now. I wonder what he's thinking about having all these shocks or not having a diagnosis. I'm also wondering, who did the CPR? What were his family thinking? You know, how do they feel? They were maybe, again, how does it feel to have a family member that doesn't have a diagnosis? You know, fear for the future. So we're thinking about the survivors, we're thinking about the family members, bystanders as well. And of course, because we have many more people, unfortunately, that don't survive, we often have many more bystanders who've done CPR where the person hasn't lived. And then they're not in contact with any kind of services afterwards. So we maybe have many more bystanders than we do have survivors. On that list also is volunteer responders. So CFR, I've talked to so many of you today, and it's amazing. And thank you so much to Lisa and the Newtons to really highlight the work of that. But that's a group that we need to be thinking about as well, I think, in South Recovery. And then we have the healthcare professionals, the EMS, you guys. And again, it's not something we've done a lot on yet, but we are aware, particularly maybe when you are maybe involved in events or doing CPR outside of your normal role or outside of your normal working hours. Of course, we're all willing to step up, but actually looking after you afterwards. So what have we been doing? Well, quite a lot around information. So something I often say is, if you've had a stroke, nobody's surprised that you might have something wrong with your brain, or you might need support or rehabilitation afterwards, but it's not something that's commonly known after cardiac arrest. So we've been working really closely with the Resuscitation Council to produce new information that we're hoping. This is a really simple leaflet. It's really just giving the beginnings of information and some signposting, hoping to get that into the hands of every cardiac arrest survivor and their family members. We've also got new resources on the NHS Inform website. So again, one place where people can go, get all the information, and then the signposting to other organisations. If you are interested in getting the leaflets, you can follow that QR code, and I think they are free, and they're certainly free to download, but the paper ones, I think, just paying for postage and packaging. So, and then that's the QR code that will take you to the NHS Inform website. Research, also vital. I would say that we are still quite a long way behind in terms of other kind of long-term conditions. In terms of cardiac arrest, we still have a lot of gaps in our knowledge about what the key priorities are for cardiac arrest survivors and how we can deliver aftercare. So I'm very pleased to say we've been funded for a 3-year research project funded by the Scottish Government called Carousel. I know, I do like to name things and have nice logos. I could talk all day about what we're going to do with the Carousel project, but at the heart of it are a series of studies that will tell us who our survivors are in Scotland, where do they go. We're going to follow them through using the SCAS out-of-hospital cardiac arrest data. We're going to follow them through the routinely collected health data. Where do they go? How long are they there for? Who are they coming into contact with? We're then going to follow a group of survivors and their family members in a quite in-depth way through questionnaires and through interviews at 4 time points after their cardiac arrest, up to a year post-cardiac arrest. The idea being that we can really then identify what are the unmet needs, where should our intervention be, who should be delivering it, and what are the priorities. So at the end of it, we're going to be doing some work with clinicians, people like yourselves, to then design this aftercare intervention. And also think about What's it going to cost? Who's going to deliver it? How are we going to implement it? Just thinking about bystanders, I can't stand here and not talk about the bystander advice line. We're so lucky that Chest, Heart and Stroke Scotland support this. Hopefully you've all seen these pink cards. These are the pink cards that are hopefully given out at the scene of a cardiac arrest. I know there's been a new project that Shorty's been delivering for the cards to actually sit in the drug pouches. So the idea is when you open them up, they almost kind of pop out or fall out. We know there's a lot going on at the scene, so we do really appreciate the fact that you are giving these cards out. We know that they're being given out because that's the main way that people are coming through the advice line. We've had 308 contacts, mostly telephone calls, since I think it's about 2.5 years that the project's been running. And what we're also seeing is a year-on-year increase in the number of contacts, the number of calls as well. So we are 27% up on the last year to the previous year. And again, so much of that is to do with the promotion, all right? Again, it's not common knowledge that if you do CPR, if you're a bystander, that you might actually need someone to talk to afterwards. So half the work with this project is getting that message out there. Again, what are we doing next? What are we thinking in terms of bystanders? We met last week at the race meeting, another natty name and logo, I know. Recovery After Cardiac Arrest, again supported by Chest, Heart and Stroke Scotland. All the people that you see there are really passionate about bystander aftercare, looking after the people who stepped up and done CPR. Some of the things that we're thinking about is what can we do at each stage of the chain of survival to reduce the impact on bystanders? Not affect survival, but are there things that we could be doing to just reduce that impact on bystanders? Access to information, communication and support, and the right support at the right time. So something we hear from bystanders is they do want to talk to someone, and we recommend that they talk to someone, but it can be pretty tough having that conversation with a friend or family member or co-worker. So having somebody independent to talk to through something like the CHSS advice line seems to be really important. One of the other things we're thinking about is when we talk to bystanders, can that help inform what we're doing at the beginning of the chain and thinking about the way that we teach CPR? So that's a bigger project that we have ongoing. So I'll come back to my first slide. I would say that we're doing okay on the survivors. Okay, there's still a lot to do, but we've made some good inroads. Again, family members, that kind of goes hand in hand. And we are making some good inroads with the bystanders. But I will be honest, South Recovery is a very small team, and we haven't really started looking at volunteer responders and healthcare professionals. So what I would say is there is lots and lots to do. So if you are interested in any of the things that I've been talking about, please do get in touch. There are lots of questions to answer and lots of, I think, quite simple ways that we can be solving some of these problems. So please do get in touch, even if it's just a case of you want to maybe offer your expertise or your experience, maybe be involved in a focus group or something like that, or you're actually thinking, I'd quite like to get involved in the research. Okay, I'm going to stop there. Oh, I forgot to say, these are just some of the groups and institutions that help out with South Recovery, and I'm really glad that Chest, Heart and Stroke Scotland and Sudden Cardiac Arrest UK were here today as well, so a big shout out to them. Right, it's me then. Is it Lisa?